Hi, I'm Jennifer Begg, Executive Lead for the Child and Youth Health Program with Northern Health. Before we get started today, I would like to take a moment to acknowledge that I am grateful to be working and learning on the traditional unceded territory of the Lheidli First Nations. While the early years are certainly a focus within the Child and Youth Health Program, much of the strategic work and support for this population occurs within the population and public health and is then operationalized within primary and community care. Our regional nursing leads, who would be best positioned to share these resources with you, are currently consumed with our pandemic response. In their absence, I am pleased to be here to share some of the work that has occurred during the last several years to support young children and their families in the North. Because I am not working with patients and community, I am unable to share how this is currently being operationalized and to what extent. So our objectives for this session are to help those working with families in the North across different sectors understand Northern Health's integrated approach to working with families with children in the early years, and to recognize that this is a complementary effort between primary and community care, population and public health, and community services. I'd then like to share and briefly discuss the primary and community care service guide content specific to children, and share and briefly discuss the Northern Health Early Childhood Development Clinical Practice Standard, or ECD-CPS. This next slide shows the Northern Health idealized system of service. Over the last decade, Northern Health has actively focused on strengthening primary and community care in recognition of the importance of primary care as the foundation of an effective integrated health system that achieves excellent population health outcomes. The Northern Health Service Distribution Framework is a fundamental tool for rationally and consistently guiding the level of service that should be offered in each community. Northern Health has developed this framework in collaboration with communities, First Nations Health Authority, and Northern Divisions of Family Practice. The framework considers community demographics, population, location, access, and existing infrastructure in order to place each community into one of 5 categories. Importantly, the framework reflects catchment area, so the referral base, and true rural service access patterns, so where people actually access their service versus prescribing service patterns that don't make sense to them. The Northern Health Framework is also guided by the Tiers of Service Framework developed by the Provincial Health Services Authority. The Tiers of Service provide a guide to the responsibilities, requirements, and critical mass for providing a safe, sustainable, and appropriate level of a specified service. This facilitates the planning and development of services appropriate to meet the needs of the relevant catchment area, so local, regional, and/or provincial services. You can see in this diagram at the center, you've got the person and family at the center of the primary care home, which then connects to community services, partners, specialized services, or specialist services as needed, all within the context of a healthy community. The first resource I would like to share is the Primary Community Care Service Guide. The services outlined in this document are services that primary care interprofessional teams are either responsible for or have a significant supporting role. The intent of this document is to provide staff with clarity on process changes arising from restructuring Northern Health operations in primary and community care and focus specialized care in the community. This document is a baseline view of services, and the intent is to update on an annual basis as we continue our primary care transformation. Most of the service for this population can be found within the population and public health section of the service guide. These services are detailed with key success factors, the target population, location services can occur, the activities that should occur, who in the team is required to provide service, and the supporting clinical tools and the support available to the individuals providing care. This is a brief snapshot to show you this also exists for 8 weeks to 6 years and for enhanced family supports. This next slide shows a clinical practice standard, or the ECD-CPS, that was developed to support interprofessional teams with the care of children 2 months to 6 years of age and their families. There are similar clinical practice standards that exist for prenatal and postpartum care. This covers the universal services for children and families and age-specific assessment priorities. It is broken down into priority areas. that are then addressed by priority actions. An example of this would be using developmental surveillance, such as the Rourke Baby Record or Ages and Stages questionnaire, to assess development of a child. These services are largely delivered by primary care nurses and/or primary care providers. There is flexibility required based on a team maturity and individual community capacity. It is important to note that this has been implemented in varying degrees in northern communities and looks different everywhere. Primary care, the CPS is in place to support the primary care interprofessional teams to provide high quality and accessible services for families with children in the early years. And these early childhood development and family services reflect and align with our Northern Health Strategic Plan, the Provincial Healthy Start initiatives, and various best approach practices to care. To avoid duplication of services, primary care nurses, primary care providers, and other primary care IPT members mutually agree to share the responsibility to offer ECD and family services within their professional scope of practice. This speaks to the flexibility I was talking about that is required in an individual community where a service may be performed by a primary care provider in one, but a primary care nurse in another. As long as the function is delivered, it doesn't matter who does it, as long as it's completed. Universal services are accessible to and inclusive of a family's diverse needs and include ongoing assessment, standardized screening, health promotion and education, and requests for service as needed. Enhanced support is accessible for families with identified vulnerabilities and/or variances and includes additional assessment and standardized screening, health promotion and education, capacity building, care coordination, more intensive follow-up, and additional requests for services as needed. Much of the enhanced support still needs to be clarified within a similar clinical practice standard that would detail enhanced supports and often would require referral out to community agencies or partners. The health of young children and their families will be improved through individual interventions and health promotion strategies for the population. Families experiencing vulnerabilities are provided with support services, interventions, and referrals as needed. This can be challenging depending on community resources. It is a team effort. Families are supported by local primary care interprofessional teams together with Northern Health Services and services within the community, like food banks, pregnancy outreach, infant childhood development programs, and the Ministry of Children and Family Development. And every community is unique. For further information, you can have a look on our website at the Chief Medical Health Officer's Child Health Status Report for Northern Health that was published in 2016, the subsequent Community Consultation Report, and Northern Health Primary and Community Care General Information page, as well as Northern Health Healthy Start information page. Thank you for your time.